Imagine waking up tomorrow to discover that the medication you've been receiving for free is now going to cost you money out of pocket. For millions across the UK, this isn't just a hypothetical scenario. It's becoming their new reality as the National Health Service implements one of the most significant overhauls to its prescription system in decades. Have you been keeping track of these changes? Do you know if your condition is on the cutting block? If you're concerned about how these cuts might affect you or your loved ones, you're not alone, and you're in the right place. Make sure to subscribe to our channel and hit the notification bell so you don't miss any of our updates on these critical healthcare changes. The NHS, Britain's beloved healthcare institution, has recently announced dramatic cuts to its prescription coverage, removing 36 common health conditions from its free treatment list. This decision sends shockwaves through communities across the United Kingdom, leaving many wondering how they'll manage their healthcare needs when these changes fully take effect. What's driving these cuts? How will they impact the everyday person? And most importantly, what alternatives exist for those affected? These are the questions we'll be answering today. Let's start with understanding the scale of this decision. The NHS has identified 36 conditions that will no longer qualify for free prescription medication. These aren't rare or obscure health issues. They're common ailments that affect millions of people every day. Conditions like hay fever, mild acne, indigestion, constipation, cold sores, and conjunctivitis are all on the list. Think about it. How many people do you know who suffer from at least one of these conditions? The likelihood is that either you or someone close to you will be directly impacted by these cuts. The rationale behind these dramatic changes stems from the NHS facing unprecedented financial pressures. Healthcare costs have been rising steadily for years, with prescription expenses representing a significant portion of the NHS budget. In the last financial year alone, the NHS spent over £9.2 billion on prescription items in England, a figure that's become increasingly unsustainable as other healthcare demands grow. But is cutting free access to medications for common conditions really the answer? Critics argue this approach may lead to more serious health problems down the line, as people delay treatment or forgo it altogether. Among the conditions no longer qualifying for free prescriptions, some of the most widespread include mild eczema and dermatitis, which affect approximately 15% of the UK population. Consider the impact on families with children suffering from these skin conditions. Parents will now face additional costs for treatments they previously received at no charge. Similarly, treatments for dandruff, which affects almost half of the adult population at some point in their lives, will now come out of patients' pockets rather than being covered by the NHS. What about headaches and migraines? These conditions affect more than 10 million people in the UK regularly. Under the new guidelines, over-the-counter painkillers for these conditions will no longer be available on prescription. For occasional headache sufferers, this might seem like a minor inconvenience. But what about chronic migraine patients who rely on regular medication to function? How will they cope with this additional financial burden? Have you considered how quickly these costs can add up for someone who needs medication frequently? Seasonal allergies represent another major category affected by the cuts, with hay fever affecting between 10–30% of adults in the UK and up to 40% of children. The impact will be felt by millions when spring arrives. Allergy medications that were previously available through free prescriptions will now need to be purchased directly, adding another expense to household budgets already stretched thin by rising living costs. The timing of these cuts couldn't be more challenging for many families. With inflation at its highest level in years and energy costs soaring, UK households are already under immense financial pressure. A recent survey found that 38% of people are concerned about affording their regular medications following these changes. For those living paycheck to paycheck, even relatively inexpensive over-the-counter medications can strain limited budgets. Have you thought about how these additional costs might affect vulnerable populations, the elderly on fixed incomes, single-parent households, or those working minimum wage jobs? Let's put this into perspective with some numbers. A typical hay fever sufferer might need to spend between £30 to £100 annually on antihistamines and nasal sprays medications they previously received for free if prescribed by their doctor. For someone managing mild eczema, the cost could range from £60 to £200 per year for various creams and emollients. And for those with chronic conditions requiring ongoing treatment, these figures could be substantially higher. When you're already struggling to pay rising bills, these additional healthcare costs can feel overwhelming. But the implications extend beyond just financial concerns. There are serious questions about how these cuts might affect public health outcomes in the long term. Will people with early-stage infections delay seeking treatment because they can't afford the medications? Could minor conditions develop into more serious health problems requiring expensive hospital treatment? Healthcare experts have raised concerns that what appears to be a cost-saving measure now might actually increase NHS expenses in the future as preventable conditions escalate into more serious medical issues. Consider the example of conditions like mild throat infections. Left untreated, these can sometimes develop into more severe infections requiring antibiotics or even hospitalization. Similarly, untreated skin conditions can worsen and lead to secondary infections. By removing free prescription access for these initial milder conditions, is the NHS potentially setting itself up for higher costs down the line? What do you think about this approach to healthcare management? The cuts also raise important questions about healthcare equity. While many people can absorb the cost of over-the-counter medications, for others, these expenses represent a significant hardship. Those with multiple conditions on the cut list face compound costs. Families with several children, all suffering from common conditions like head lice or mild eczema, could find themselves paying substantial sums for treatments that were previously free. Does this create a two-tier healthcare system, where those with financial means can address health issues promptly, while others must choose between medication and other essential expenses? It's worth noting that certain groups will still be exempt from prescription charges entirely. Children under 16, adults over 60, pregnant women, and those with specific medical conditions will continue receiving free prescriptions regardless of what condition they're treating. Additionally, those on certain benefits or with low incomes may qualify for financial help through the NHS low-income scheme. But many working families who don't qualify for these exemptions will feel the full impact of these changes. The NHS has defended its decision by pointing out that many of the affected medications are already available over the counter at relatively low prices. Officials argue that by redirecting prescription resources away from conditions that can be self-managed, they can better focus on more serious health issues and emergency care. They estimate the cuts could save the NHS up to £100 million annually, money that could fund approximately 2,500 more community nurses or 25,000 more cataract operations. When framed this way, do you see merit in their approach? So what are the alternatives for those affected by these cuts? One option is to explore discount pharmacy programs and wholesale clubs that offer reduced prices on over-the-counter medications. Buying generic brands rather than name-brand medications can also significantly reduce costs. For those with recurring conditions, purchasing medications in bulk during sales, or using online pharmacy services that offer competitive pricing may help manage expenses.